Ever wondered why some people wear glasses or contacts? It's all because of refractive errors. In this video, we'll explore what they are, their causes, and the different treatments available. Refractive errors occur when the shape of the eye or the cornea prevents light from being focused correctly onto the retina. This results in blurry vision. Factors like genetics, aging, and medical conditions can cause refractive errors. The most common types are nearsightedness, farsightedness, and astigmatism. Nearsightedness occurs when the eye is too long, causing trouble seeing distant objects. Farsightedness occurs when the eye is too short, causing trouble seeing close-up objects. Astigmatism occurs when the cornea is not perfectly round, causing distorted or blurry vision. Treatments include glasses, contacts, and refractive surgery like LASIK. Refractive surgery is a surgical procedure that aims to correct refractive errors, such as nearsightedness, farsightedness, and astigmatism. In this video, we'll explore the different types of refractive surgery and how they work. Types of refractive surgery. The most common types of refractive surgery include LASIK, PRK, and SMILE. LASIK. LASIK is a popular type of refractive surgery that uses a laser to reshape the cornea. During the procedure, a thin flap is created on the cornea, which is then lifted to allow the laser to reshape the underlying tissue. The flap is then placed back in position. PRK. PRK is similar to LASIK, but instead of creating a flap, the surgeon removes the entire outer layer of the cornea to allow the laser to reshape the underlying tissue. The outer layer then regenerates over the next few days. SMILE. SMILE is a newer type of refractive surgery that uses a laser to create a small incision in the cornea. The surgeon then removes a small piece of tissue through the incision, which reshapes the cornea and corrects the refractive error. Recovery. After refractive surgery, most patients experience some discomfort and visual disturbances. However, the recovery time varies depending on the type of surgery. Refractive surgery is a safe and effective way to correct refractive errors and improve vision. If you're considering refractive surgery, talk to your eye doctor to determine the best option for you. Remember, refractive surgery is not for everyone, and it's important to have realistic expectations about the outcome. Degenerative myopia, also known as pathological myopia or high myopia, is a condition that causes the eyeball to elongate, resulting in nearsightedness that worsens over time. In this video, we'll explore the causes, symptoms, and treatments of degenerative myopia. Causes. The exact cause of degenerative myopia is unknown, but genetics and environmental factors can play a role. People with a family history of the condition are more likely to develop it. Additionally, activities that require prolonged near vision, such as reading or using a computer, can increase the risk of developing degenerative myopia. Symptoms. Symptoms of degenerative myopia include blurred vision, difficulty seeing at night, and a higher risk of retinal detachment and other eye problems. In some cases, the condition can progress to a point where glasses or contact lenses are no longer effective in correcting vision. Treatment. There is currently no cure for degenerative myopia, but there are several treatment options that can help manage the condition. These include glasses or contact lenses. These can help correct vision in the early stages of degenerative myopia. Orthokeratology. This involves wearing special contact lenses that reshape the cornea overnight, temporarily correcting vision during the day. Atropine eye drops. These can slow down the progression of degenerative myopia by relaxing the muscles in the eye that control focus. Refractive surgery. In severe cases, refractive surgery can be used to correct vision and reduce the elongation of the eyeball. Conclusion. Degenerative myopia is a serious condition that can lead to vision loss and other eye problems. If you're experiencing symptoms of degenerative myopia, it's important to see an eye doctor as soon as possible. Early diagnosis and treatment can help slow down the progression of the condition and preserve your vision. Amblyopia. Amblyopia refers to a refractive error where the eye is unable to focus light properly onto the retina, resulting in blurred vision. This includes nearsightedness, myopia, farsightedness, hyperopia, and astigmatism. Amblyopia. Emmetropia is a term used to describe normal vision, where light is focused properly onto the retina and no corrective lenses are needed. Isometropia. Isometropia is a condition where both eyes have the same refractive error, whether it be myopia, hyperopia, or astigmatism. This means that the same prescription for glasses or contact lenses can be used for both eyes. Anisometropia. Anisometropia is a condition where each eye has a different refractive error, resulting in different levels of visual acuity between the two eyes. This can lead to eye strain, headaches, and difficulty with depth perception. Anisometropia is commonly corrected with glasses or contact lenses that have different prescriptions for each eye. Amblyopia, also known as lazy eye, is a condition where one eye has reduced vision that cannot be fully corrected with glasses or contact lenses. The brain suppresses or ignores the information coming from the weaker eye and relies more on the information from the stronger eye. This can result in poor depth perception and decreased visual acuity in the affected eye. Amblyopia typically occurs in childhood when the visual system is still developing. It is often caused by a misalignment of the eyes, strabismus, or by a significant difference in the refractive error between the two eyes, anisometropia. Other causes can include congenital cataracts or other visual obstructions. The earlier amblyopia is detected and treated, the better the chance of improving vision. Treatment options include patching or blurring the stronger eye to encourage the weaker eye to work harder, as well as corrective glasses or contact lenses. In some cases, surgery may be necessary to realign the eyes. In conclusion, refractive errors are a common and treatable condition that can significantly impact one's vision and quality of life. It is important to undergo regular eye exams to detect and correct any refractive errors early on, as well as to explore the various treatment options available. With proper care and management, individuals with refractive errors can achieve clear and comfortable vision, allowing them to fully engage in their daily activities and enjoy the world around them. Thank you for watching, and I hope you found this video informative and helpful.